Hello friends, we're doing part 2 of the traveling safe in summer video. If you're taking a long flight to an international or a national destination where you'll be in closed space in an aircraft for a long period of time, what are the precautions you need to take so that you are safe and your family is safe? So a common problem that comes up in flights is being in closed spaces and people tend to, someone or the other has a cold, cough, sneezing. And in such a situation, it becomes very important for you to carry some antibacterial wipes and wipe down your sitting area and your tray table so that if anything you touch or use there is not a fomite or a source of infection for you. Similarly, wearing a mask is a very good idea, preferably an N95 mask, but at least a 3-ply surgical mask, especially when we know that viral infections are rampant and widespread post-COVID and even during summer months. The next thing that commonly comes up in flights is you will see very often people get severe ear pain during takeoff or landing, or babies start crying because they have ear pain which they can't express. And this usually occurs due to something called eustachian tube dysfunction. And an easy way to deal with this is to keep swallowing either your saliva or chewing gum or drinking some fluid or doing something called a Valsalva maneuver. Close your mouth, pinch your nose and try to blow out. And by doing this, you open up the eustachian tube, and in that process you end up not having the pain because the pressure gets equalized and balanced between your outer ear and your inner ear in terms of your eardrum. Now, another issue that commonly comes up is people sit for long hours and they can end up with swelling on their feet, or they can end up with, in rare cases, even blood clots during very long flights. And to prevent this, it's very important to keep getting up, moving around, taking a short walk maybe every hour or two. You can do flexion exercises with your ankles. You can do heel raises. You can also do just rotations of your ankles clockwise, anti-clockwise. And some people who have a tendency for swollen feet can actually wear compression stockings. All of these can go a very long way in preventing problems after you land because you don't want to run into problems there. Another thing that commonly comes and which can be prevented is because of the risk of infections, getting vaccines. So if you're taking your influenza vaccination, if you're keeping yourself protected, if there is a high risk individual, then they may need even their pneumonia vaccines when they are traveling in crowds or groups. Now remember that some of these precautions like wearing the mask are not just on the flight but also in busy airports. Next thing that is commonly seen on flights is people experience a lot of dryness in their nose, dryness in their eyes. They also feel sort of dehydrated. So hydrating well is very important when you're flying. Also, if you consume too much alcohol, you can further dehydrate yourself. So avoiding alcohol becomes a great way of preventing some of these problems. When we look at this overall picture and we are aware of where we are, what we are doing, what we are eating, drinking, it becomes equally important because I'm an allergist immunologist. There are people with food allergies who travel on planes. And on planes, if you happen to get exposed to something that you're allergic to and you have a severe or life-threatening allergy, it's very important that you have your adrenaline injection called EpiPen, Adrenaclick. There are many brands. You can also have it filled by your allergist and given to you. But carrying these injections with you, carrying your anti-allergic medicines with you, carrying an inhaler with you if you have asthma becomes very, very important on flights or any other such long travels. So friends, if you want to stay safe, you want to really enjoy your vacation, not end up with illness or sickness, where you are going and what you are going for, it becomes very, very important that you take some of these precautionary steps and take good care of yourself and have fun on your vacation or on your business trip if that's where you are going. So till the next video, this is Dr. Sitesh Roy, your allergist, immunologist, asthma specialist, signing off. Take care and God bless us all.